from the Women's Correction Suicide Prevention. So, Amy, if you're available.
Hi, can you hear me fine? This is Amy Johnson.
Yes, ma'am, we can hear you.
Great. Thanks for having me today. My name is, like I said, Amy Johnson. I'm a clinical social worker by background, and I'm here to speak with you on behalf of our Office of Mental Health and Suicide Prevention, specifically in the Suicide Prevention Program. I'll be giving you an overview of suicide prevention. This presentation is quite brief. If anyone would like to have a more lengthy or thorough presentation, please feel free to contact me. I'll give you my email now, which just to make sure you have it, which is my first name is Amy, AIMEE JOHNSON@va.gov. And thanks, Tony. You can go ahead and advance the first slide. So I'll give you, like I said, a brief overview of suicide as a major public health problem in the United States that affects all people. I'll also highlight what our public health approach to suicide prevention is and what that means, as well as an update on our work regarding the executive order and some resources that hopefully you can use in your local communities. And I'd also like to make sure that I highlight the role of, that we see the Veteran Experience Office in helping us with some local community work, which I'll cover towards the end of the slide deck. Next slide. And you can advance the next thing. So hopefully everyone here today understands that the problem of suicide affects everyone, right? That whether we're looking at our youth or those of us who are civilian or those of us who have served in the military, this is a human problem. We've had a lot more attention in media in the last, I'd say, probably 3 to 4 months with the high-profile losses of Anthony Bourdain and Kate Spade. So there's been some renewed focus on the need to come together and ask everyone to play a role in preventing suicide. Broadly, suicide is a public health problem that is the 10th leading cause of death. That means that we have more suicides than murders in this country. That's something that a lot of folks think is the opposite. Annually, it's also an expensive, complicated loss to the country with billions of dollars being spent on the impact of someone's loss. On average, there's about 45,000 deaths a year. We know that suicide is a unique issue within the veteran population as well as active duty service members. And specifically, some populations that are at increased risk for suicide are here listed under populations at risk. So among the veteran population, those male veterans over the age of 50, female veterans, veterans who are new in the respect that they were active duty and then they transitioned to become veterans within the first 12 months of that period of transition out of the military, there is an increase in suicide as well. Exposure to suicide means that knowing someone who died by suicide, especially a parent, but anyone who perhaps we served with or someone close to us can impact us, and that's true for everyone. And then folks who have access to lethal means, which most typically is referring to firearms. In women, they tend to also use medication to overdose on when it comes to suicidal behavior. So these are some high-level populations who we know are at risk, and we're working hard at VA to do more for. Next slide, please. Suicide is preventable, and this is not something that necessarily everyone agrees or accepts, but it's certainly true, and our research supports that. The trouble with sometimes thinking about suicide as being preventable is for those of us who've been affected by loss, it's such a complicated way to lose someone that it can leave a lot of us feeling burdened by what could we have done differently. And so it's not to say that somebody is guilty for another person's loss, but what it means is that we have to take more preventable approaches to reaching people who might be at risk, hopefully to reach them before there is a crisis. But it really is important to know that at VA, we believe strongly that we can prevent suicide. Next slide, please. So I'll speak more here about specific risk factors within the veteran population. And again, I just have to say, I feel like I'm speaking pretty quickly, so please reach out if you would like a more in-depth presentation. Next slide, please. So as I mentioned earlier, we know that there's over 40,000 deaths a year. This slide helps to explain the crosswalk between Americans who die by suicide, which includes civilians, and then the data that we have about veterans who die by suicide. So on any given day, we lose about 123 Americans to suicide. We know that among that, 20 or so of the veterans are, or 20 or so of the suicide decedents are veterans, and then 1 to 2 are active duty service members. I think the important thing to highlight here, aside again from us all taking away that regardless of someone's military service, we should all take a role and see ourselves as a steward for suicide prevention, but also that the majority of veterans who die by suicide are not receiving care within VHA. That's a really important place for those of you working within the CVEBs or within your communities to think about, because we know a lot about people who receive care from the Veterans Health Administration, but we don't know a lot about those who don't come to us. Next slide, please. So whenever we talk about risk factors, which there's some more specific risk factors listed here, it's really important that we talk about protective factors, because we know that when we, for example, enhance connectedness to people, and that can be through our family and friends, it can be through our unit and the people that we serve with, it can be through our employer, it can be through coming to the VA and connecting with other veterans. But connectedness really matters. When people are starting to feel like they're a burden on someone else, when people are struggling with addiction or substance use problems, or when there's a relationship fallout and they're isolating, enhancing connectedness is really a key thing that all of us can do. I also want to point out that this month is Suicide Prevention Month, and we have an entire campaign which are calls to action for the public to consider of how they can be there for someone in their life. It's called the #BeThere campaign. And I hope that all of you can look that up on social media at some point and think through some really small actions that you could take to someone in your life who maybe you haven't connected with lately, or maybe someone that you know is going through one of these risk struggles that you could reach out to. There's some more protective factors here, which again I could go into in a lengthier discussion, but we know that when people have access to mental health care, they do better. Spirituality is a protective factor. Having a sense of mission or purpose is key, especially for folks who have served in our military and sometimes struggle to find that mission or purpose after, or perhaps have found fantastic mission or purpose and they can actually share that with other fellow veterans. Next slide, please. So you've probably seen some different slides today about the total veteran population, but just to point out that we know more female veterans are receiving care from VA than in the past, and we have more female veterans now. And I'm sorry I didn't see the full former presentation before me by the Women's Health Program or the Women Veterans Program, but I'll defer to the slide that they shared with you. What's important for you to know is that we have seen within our female veterans a need to focus more prevention efforts when it comes to suicide prevention. They have a higher rate of suicide than their civilian counterparts. And so we're working hard to figure out all the different ways that we could try to intervene with women veterans, both upstream, broad approaches, and more downstream approaches for folks who we know are in crisis. Next slide, please. When I mention downstream or upstream approach, we'll get into the public health approach, and I'll give you a high-level overview of what that means. And if you can advance to the next slide. So we need to take a public health approach to preventing suicide, because if we only take, for example, a healthcare approach with people who we know have risk factors, then we're missing a much broader part of the population. So within a public health approach, we know that this, by the way, is a public health approach is used for various health problems, for various other efforts to reach people and to teach them about a number of things. But there's 4 different key parts of a public health approach, and they're listed here. First, you define and monitor a problem. Secondly, you look for what risk and protective factors are. And then thirdly, which we do at VA, and of course are working with partners to try to do more of, which is develop and test prevention strategies. And then, based on our data and research, disseminate what works. And so when I mentioned earlier, for example, that enhancing social connectedness can actually save people's lives, that's something that a lot of people may not have thought of as something that we would do in suicide prevention, but we actually have a lot of good science to support the impact of social connectedness and instilling hope in people's lives. So that's just one example. Next slide, please. So we learn more about the public health approach from the National Academy of Medicine. And again, we look to deciding how we can have approaches where we can reach people at different levels. So for example, if we're looking at an entire population, we would look at this universal or all approach. And this would be strategies that we design where we can try to reach, for example, all veterans. So even veterans who may not have suicide risk. Then we want to look to make sure that we have approaches that reach people who may have some risk, for example, based on gender, age, or a number of things that we can't change in someone's life. Then we can have selective strategies. So these are prevention strategies where there's subgroups that you're trying to reach. And then we have indicated prevention strategies. And this is where, for example, at VA, we have certain things that we do when we can tell that somebody's at a high risk for suicide and they're receiving care from us. This is also where, in part, the Veterans Crisis Line is meant to reach people in the selective and indicated categories. So just a little bit more here for your understanding about how we think through different levels of prevention. Next slide, please. As I mentioned earlier, we know that at least 50% of veterans do not use VBA benefits or health care. And this means that we have to go to our communities, right? We need the fantastic community veteran engagement boards throughout the country. We need your help in guiding us to reach veterans who we are not reaching. And we really can't do enough of that. I'm going to give you one example, which is our Mayor's Challenge work of community level effort. But this is a slide just to highlight the need for us to partner outside of our walls at VA. Next slide, please. Some of you may have heard of the executive order. Specifically, this executive order that I'm referring to is one that was signed by the President in January of this year. And the title is Supporting Our Veterans During Their Transition from Uniformed Service to Civilian Life. Next slide, please. So this executive order, which again the number is here for your reference, it asks that multiple federal agencies work together. So our agency at VA, along with the Department of Defense and Department of Homeland Security, come together to enhance access to mental health care and resources within suicide prevention. One of the timeframes that gives us concern about transition is the first year I mentioned of transition out of the military into civilian life. We see a spike in suicidal behavior within especially those first 90 days. So the goal is here to create a joint action plan, which was done, and to improve various parts of the transition. I think some folks are aware of this. Some folks may not have heard of this executive order, but there's been work underway really since its inception in January across the departments, and we're working very closely to show impact and changing our approach to make sure, for example, that folks know how they can access the benefit of Veterans Health Administration. Folks know that they can reach out to the VBA and find out about other benefits they may be eligible to, but trying to stay in touch with folks when they transition out of the military is key. Next slide, please. I'll cover here some resources, and I'll stop in just a couple minutes to see if there's any questions that I could take as well, but I want to make sure that you know what resources you could be disseminating in your communities. Next slide, please. So hopefully everyone here knows about the Veteran and Military Crisis Line. Some may not realize that it's branded both for veterans and then also for military. Oftentimes the branding is separated. The goal is to try to reach anyone who's active duty, Guard, Reserve, or veterans, regardless of the period of time they served. Everyone can use this line. We opened our third call center last fall, which is in Topeka, Kansas, and the number, of course, is here. Next slide, please. The hashtag Be There campaign that I mentioned earlier is meant to give the public and anyone who knows a service member or veteran ideas of how they can show up for someone and give them resources. And it allows us to all have actionable next steps that we can take with someone that we know, but they also apply to folks in the general population as well, like reaching out to see how someone's doing, asking someone to go to coffee, asking to take someone to a medical appointment who you know might be struggling. We have a whole campaign which includes public service announcements, and you can also see BeThereForVeterans.com, but this is just a reminder of that campaign that's ongoing. Next slide, please. Make the Connection is a website, maketheconnection.net, that some folks may not be aware of. This is a fantastic resource to make sure that you help spread to your organizations, but also to people who you know who may be ambivalent about getting help. It's a catalog of videos of veterans talking about their own experience of what they struggled with and how they worked through that struggle with various things, including treatment. You could actually search on the website by era of service, by problem, and you can see people share their stories. It's a very well done resource, and if you can help us spread the word about this, we'd appreciate it. Next slide, please. Coaching into Care is also a fantastic resource that is ran out of one of our research centers, and Coaching into Care allows you to actually call or visit a website, and you can get help trying to figure out how to get somebody resources and how to coach them into more help-seeking behavior. And this is a project that's been going on at VA for years, and some folks may not be aware of that, so please check that out. Next slide, please. Hopefully you're aware of our integrated suicide prevention coordinators throughout the healthcare system here at VA. We have more than 400 people who are licensed mental health providers who were hired to do a myriad of different things, including community outreach and education about suicide prevention, and then also have roles within their medical centers. And you can actually search by zip code to see who your nearest suicide prevention team is on this resource locator that's referenced here. Next slide, please. So the Mayor's Challenge is an example of a community level approach that we started about a year ago, and actually the Veterans Experience Office has been excited to join us in this, and we're hoping to start making some closer connections to those of you, for example, in the Houston area who may be here today, or in one of these other 7 cities. We do plan to add more cities, but what the Mayor's Challenge is it's creating a community-level partnership between the VA and SAMHSA, and then different organizations and efforts that are already going on, or perhaps thinking through new opportunities for communities to prevent suicide on a local level. So they're collaborative teams, and oftentimes there's some government level, either county or state involvement, but again, really trying to organize around the different resources that we offer veterans and trying to show more of an integrated approach in a community for trying to prevent suicide. And if anyone has questions about the Mayor's Challenge, you can reach out to me. But our hope is that through the CVEB, you can help us with this effort that's already underway. There's technical assistance that SAMHSA is helping us provide in communities, and there's been a series of trainings, for example, where the cities highlighted here came to Washington, D.C. and participated in a few different workshops, and that will be ongoing. Next slide, please. I'm happy to take any questions. I appreciate your time and your interest and the work that you do. And Tony, should I just open it up now for questions?
Yeah, hey, thanks, Amy. I'm going to defer to Eric on that because he's hosting this district event. So, Eric, what's your timeline look like? Hey, Eric?
Hey, Tony, can you hear me?
Yep, I got you.
Okay, sorry, we were muted back there. But no, we're going to have to move on. We are behind our timeline.